Hello, my name is Veronica Ajewale. I'm an associate professor of pharmacy practice and the director for the Community Engagement Core of the NIH-funded Center for Biomedical and Minority Health Research here at Texas Southern University. I want to say a big thank you to you and the community members for joining us for today's program. We are really excited that we will be sharing a lot of great information alongside the experts or speakers and panelists that will be leading us into this conversation. So please have your questions ready. We would have an opportunity to take your questions after today's presentations. So thank you again for joining us, and we look forward to our continued collaboration. Thank you.
Good afternoon, everyone. My name is Virgil Elkins, and I have the pleasure of serving today as you all's host. I am the project manager for the TSU Center for Biomedical and Minority Health Research Community Engagement Core, and welcome to Prevention and Protection Strategies for Reducing the Spread of STIs.
University's Center for Biomedical and Minority Health Research Community Engagement Core is funded by the National Institute of Minority Health and Health Disparity Research Center for Minority Institutions program. The CEC works directly with communities to identify and address health-related concerns and reduce health disparities related to ethnic minorities. We provide health education and partnerships with healthcare systems, federally qualified health centers, community and faith-based organizations. For more information, visit us on social media at CEC Texas Southern U, or give us a call at 713-313-1233, or send us an email at cbmhrcommunity@tsu.edu. Texas Southern University.
All right, so before we get started with the program today, I want to go over a couple of announcements. Again, welcome to our presentation. We have a lot of information to present to you. I'm very excited to present eventually the three guest speakers that'll be here. There will be a question and answer session for the people in person, so I hope you grab your index cards from the sign-in table, as well as our visitors online. If you would, be sure there's someone that's monitoring the webinar, so be sure to put your questions in the chat, and someone will answer the questions here in person with one of the guest speakers. And then we'll move to the next slide. We want to say a special thank you to our sponsors, Aflac, Walmart, as well as Aetna. And then on behalf of Dr. Veronica Ajewale, we want to say thank you to our guests here today, the three guest speakers that will be speaking to you. We are very proud and very happy to have them here. So thank you guys for being here with us today. And before I get started and introduce you guys to our guest speakers, I want to bring up my colleague, Mr. Mark Garza, who will go over the new program that we have here at TSU, the EQB Med program.
Good afternoon, everyone. I want to say thank you guys for being here today. Like Virgil said, my name is Mark Ibarra. I'm the clinical research coordinator for the EQB Med initiative that we have going on here at Texas Southern University. The Equitable Breakthroughs in Medicine Development Program was launched at Texas Southern University to help bridge certain gaps in our community. One of those gaps includes addressing misrepresentation of the African American population. And we hope to really get a good handle on that and bridge that gap. Our main goal here is to become a clinical research site and to get our first trial started by early 2025. We have come quite a way with the help of our partners, UTMB, Morehouse School of Medicine, and Yale University, since I started here in September, but we still have a lot of work to do. If you guys would like more information about our initiative and what we're trying to get started here, I have a table set up right outside. For our online viewers, feel free to shoot questions in that chat box that Virgil was mentioning, and we will get those answered for you. Thank you guys so much for your time. I'll give it back to Virgil here.
Awesome. Thank you, Mark. I appreciate it. And then for more information, we have right here So you're able to scan the QR code, and that'll link you to the page for more information about the EQB Med program. Again, welcome everyone. As stated before, I am Virgil Elkins, Project Manager for the TSU CEC CBMHR program. If you would, scan the QR code, or at the end of the program, we ask that you scan the QR code, one, to complete the survey. If you're a community health worker and looking for continuing education credits, please scan the QR code, scroll down to the sign-in form, and then complete the evaluation form as well. And then also, this is for us to sign in for people who are online. Please click the link to sign in to show participation for being here today. And then for the people that are here in person, you do qualify for a $15 gift card, providing you sign in online, follow us on one of our social media platforms, and lastly, complete a paper survey and turn it in to the people at the desk. Without further ado, I'd like to introduce you guys, our guest speakers, as well as our panelists today. I'll start off with Dr. Hongwei Wang. Dr. Wang is a PharmD, professor of pharmacy, associate professor of pharmacy practice at Texas Southern University, and is also an infectious disease clinical pharmacist practicing at Houston Methodist Texas Medical Center. Her research focuses on access, adherence, and therapeutic drug monitoring in care for adults with HIV prevention and treatment for minority communities through the implementation science strategies. Her long-term career goal is to become an HIV patient-centered pharmacy practice investigator, serving minority communities with health disparities and training the next generation of pharmacy professionals, particularly those underrepresented in science and research. She received grants from the NIMHD through the NIH Supplement Award to implement pharmacy-based HIV prevention services, and through the RCMI Coordination Center to support minority older adults in the transition of care. If you'll give it up for Dr. Hongwei Wang, excuse me. And I'm gonna read their biographies first, and then they'll come up and do the presentation. Next, we have Dr. Dominique Gwynn. Dr. Gwynn is an associate professor in the College of Education at Texas Southern University, originally from Hot Springs, Arkansas. She completed her education at Hot Springs High School and the University of the Ozarks. Driven by a passion for public health, she pursued a post-baccalaureate degree at the University of Arkansas College of Public Health and obtained her master's degree from Texas Southern University and earned a PhD in health studies from Texas Women's University. With over 25 years of public health experience, Dr. Gwynn has been dedicated to eliminating health disparities. As an assistant professor, Dr. Gwynn teaches courses in human sexuality, health politics, health seminar, social and cultural influences on health and biological functions. Her research focuses on PrEP, uptake, and the impact of race, ethnicity, class, and gender on HIV/AIDS. Additionally, Dr. Gwynn serves as a project director for the TSU SHAPE Initiative, Brothers Project, providing clinical services, education, and outreach on campus and in Greater Houston. Dr. Dominique Gwynn. And last but certainly not least, Dr. Sheetal Patel is an associate professor at Baylor College of Medicine, Department of Medicine, Section of Infectious Disease. Her expertise includes more than 15 years of vaccine clinical trials, research, as well as research, education, and clinical efforts dedicated to improving the health of underserved and diverse communities, particularly those living with or at risk of HIV. Dr. Patel has provided care for patients with HIV at the Thomas Street Health Center and the Ben Taub Hospital, Harris Health, Houston, Texas, since 2003, and has served on the Houston area Ryan White Planning Council for the last 8 years. She is also the director of the Baylor College of Medicine Houston AIDS Education and Training Center, regional partner of the South Central AETC, and has helped develop a network of more than 5,000 health professionals locally and statewide to work towards ending the HIV epidemic. Her and her team have developed multiple educational and capacity building initiatives, including multiple ECHO or ECHO programs, education health professionals on HIV testing, prevention, sexual health since 2013, she has strengthened the Houston AETC program with local and regional partnerships and collaborations to expand capacity and help health professionals improve the health and quality of the life of patients with and at risk for HIV. Dr. Patel. So first, I'd like to start off with Dr. Wayne. Without further ado, Dr. Wayne. Or okay, excuse me, Dr. Gwen, excuse me. And this is the clicker here.
Okay. Oops. Good afternoon. I am so excited today to talk to you about STIs. We don't really get an opportunity to do it very much, and it is so important on a college campus. More so because most of persons on a college campus are 18 to 24 traditionally, sometimes older, but the greatest issues that you face on a college campus are sexual and reproductive health issues. So again, really excited to speak on this today. So we're talking about prevention and protection strategies for reducing STIs. Dr. Sheetal Patel, myself, and Dr. Hong Mei Wang. First, we have no conflicts of interest, nothing to disclose. So our objectives today, we're going to discuss what it means to be sexually healthy. We're going to outline the sexually transmitted infection landscape and discuss sexual health and the prevention of HIV and other sexually transmitted infections. So we're defining sexual health. A state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. We know that the World Health Organization, many years ago, the definition for health was the absence of disease. And we all know that health, true health, is really more than just the absence of disease. And sexual health is just the same. What it requires is a positive and respectful approach to sexuality and sexual relationships. And I can tell you here on campus at TSU SHAPE Initiative, we focus on sex positivity and being able to talk about sex. The possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. Moving on, the ability to embrace and enjoy sex throughout your lifetime. And it's an important part of physical and emotional health. So also, being sexually healthy means understanding that sexuality is a natural part of life, and it's more than just your sexual behavior. It's reproduction, it's so many things. And recognizing and respecting sexual rights that we all share. Also, having access, and this is so important because, you know, when we know better, oftentimes we do better. Having access to sexual health information, education, and care. Preventing unintended pregnancies and STIs, and then seeking care and treatment when necessary and when needed. Being able to experience sexual pleasure, satisfaction, and intimacy, and then also being able to communicate about it. And we know that because of taboos, stigmas, culture, you know, we're not always comfortable talking about sex and sexuality. And then including having these conversations with your health partners, your sexual partners, and then healthcare providers. Our doctors are who we should be comfortable telling everything to, right or wrong. Yes, and oftentimes when it comes to sexuality, those are the things that we're not often comfortable sharing with our medical providers. So, what is a sexually transmitted infection? Well, they're illnesses that are passed from one person to another through sexual contact, but they can be prevented. All can be prevented. Now, going back to what are STIs, there are two big categories or classifications: bacterial infections and viral infections. When we're talking about bacterial infections, with them we know those are things that can be treated and cured. Viral infections, we can treat the symptoms, but cannot per se cure the disease. Now, how are STIs spread? No doubt. Okay. Spread by the exchange of body fluids, breast milk, blood, vaginal fluids, semen, sexual contact, oral, vaginal, anal, sharing of needles, mother to child. But as it shows at the bottom, not all STDs are transmitted by body fluids. You have some STDs that are transmitted by skin-to-skin contact, and that's, say, genital herpes, syphilis. And I believe
So let's review the STI cases. Basically, as you can see, compared to 2018, this is 2021 data. So we can see actually increase of almost all of the STIs. Compared to 2018, it's over 1.6 million the chlamydia cases, and also increasing of the cases of newborn syphilis, which is almost twofold compared to 2018. All of this increase of the STI cases actually cause a lot of transmission, public health issues, and also the complications. So let's talk and test and treat STI cases. Okay, so this are the STIs, like, as you can tell, chlamydia, gonorrhea, and syphilis. They all increase the chance of getting HIV, and also STI increase the chance of transmitting HIV to others. So those, as you can see, the new HIV infection actually attributed to STIs are really costly. This was the kind of old data. Now the cost is even more than before. It's already over like 800 million in the cost. And also you can see actually 6% of the sexual acquired HIV infection are attributed to those STI, the chlamydia, gonorrhea, and the syphilis. So you can see the lifetime cost to treat one person with HIV infection is actually over 500,000. Like I said, the cost is even increased more in this year. And also, I want you to know the risk. Basically, get tested is the most, I would say, very important, and also reduce the risk behavioral behaviors, and also get some vaccines, for example, against the HPV vaccine. There are some unique factors attribute to the use, actually even increase the risk. For example, the insufficient screening and also confidentiality concerns. The youth usually, or the young adult, are more concerned about the confidentiality. So those are very concern. Actually, may delay the diagnosis, and also, as you can see, the young adult actually have more high risk because they may not develop well and easy to get the transmitted to the STI, and those young adults may be lack of access of the health care, and possibly this population have multiple sex partners, increased STI risk. So what are those ways to reduce the risk? STI prevention method, we will discuss more actually in the future slides, but these are some of those which can be used to prevent STIs. So monogamous relationship, meaning each person have one partner, and also each person has had STI testing, and also consistently use of the barrier method. For example, condoms and female condoms, oral condoms, etc. Also use the water-based lubricants. Why is water-based lubricants? And avoid the oil-based lubricants. Those actually oil-based may break the condom and actually increase the STI risk. Be aware of increase the risk associated with sex when under influence, for example, alcohol or drug. Also know the signs and symptoms of STI. We'll have some review of some of those STI signs and symptoms. And you may have STI, but do not have symptom. We'll give you more explanation in the future slides. How to know the status. Testing, testing, and testing. That's the most important thing. And how to 100% reduction is abstinence. We also know the symptoms. What are those STIs? STIs are those infections transmitted through sexual contact, including vaginal, anal, or oral contact. It is important to know that many people can be asymptomatic, so testing regularly is important. So to get diagnosed so that can start a treatment. So recommend for those people who may have actual sex activity to get tested every 6 months. And STI, because it can cause a lot of complications, so treatment should not be delayed to prevent any of the complications. And we will also talk about how to prevent, including the barrier method and also some medication options. So let's review about some of the common STIs. What are the symptoms? Like we said, not all the STI may have a symptom. So for example, chlamydia, it may not have symptom, but it's often asymptomatic, meaning don't have any symptom. But it may have some symptom, for example, pain while urinating, and abnormal vaginal bleeding, and pain during sex, or yellow discharge. And also, as you can see on the right side, the syphilis, it has multiple stages. The primary stage may mainly showing some penis ulcer. And then after it's progressing to second stage, then you may see some skin changes. And then the latent stage then become asymptomatic. And then the tertiary stage will showing more disseminated diseases may affect the brain or the heart. And as you can see the left bottom trichomonasis, it is actually a type of parasite. And this may cause some symptoms, for example, the itchiness, bleeding after sex, pain during sex, or vaginal discharge. And gonorrhea, the symptom may be around the genital urinary tract, including pain during sex, vaginal discharge, pain while urinating, or bleeding between the menstrual period. And then HPV is a type of virus. And HPV, as you know, there's a vaccine that can be given to prevent this. And HPV can cause really various infection and symptoms. The most common one are the anal genital warts. It's a type of bumps, and sometimes in the shape of cauliflower appear. And also HIV, many of you probably also know this is a type of virus, and it attacks the immune system. After years of infection, it may have the reduce of the immune system and then cause this so-called AIDS. And AIDS is the names acquired immunodeficiency symptom. At this stage, the people infected will lose many of the immune function and then cause many of the other opportunistic infections. With some proper treatment, now the treatment, advance of the treatment, and person with HIV can really live long and healthy lives. And also, if the viral load is undetectable, it's actually untransmissible. Next one. So let's talk about this picture, actually, as you can see more about the protection and the prevention. The common health promotion interventions like condom, risk reduction, or education, some of the strategy we discussed before actually can prevent HIV and some bacterial STIs. And also, we talk about the HIV prevention, like HIV testing, treatment with antiretroviral treatment, and also HIV prevention, including PrEP or post called PEP. And the doctor will talk more about the PrEP and the PEP. And also, you can see the bacterial STI prevention also including like testing, treatment, and the PrEP and the PEP. Talk more about the PrEP and the PEP in the future slides. And also, some of the vaccine already approved by FDI to prevent some of the transmissible diseases like hepatitis A, hepatitis B, HPV, and Mpox. And some others, like showing here in the blue, they are under investigation, and those showed in the orange are actually in the development phase. So we will talk more about prevention and protection. Dr. Patel.
All right. Okay, good afternoon, good early evening. So I'm just going to go back to, can we go back to the last slide? Okay, I can just, okay. So I just wanted to pause here and just us take a look at the slide of just all the tools in the toolbox, right? So we're talking about like being sexually healthy. We talk about mental health, we talk about physical health, and sexual health is a core component of you having a healthy overall life, right? The problem is, as Dr. Gwynn mentioned, sometimes it's hard to have that discussion in that provider, your doctor's visit, where you're at. The doctor or the nurse practitioner or PA doesn't feel comfortable talking about sex, and then you don't feel talking like, do I trust this person? Do I tell them all of what's going on? And the key is we together have to figure out how to break that barrier, right? So pull your health professionals into the conversation, and we're going to push the health professionals to get into the conversation, to really say this is a core part, right? And it's natural history. Everything was focused on physical health, and now there's much more emphasis on mental health, and we need to make sure we're emphasizing sexual health too. Lots of tools in the toolbox, lots of preventative tools, right? So vaccines and pills that we're going to talk about. Lots in development. So these are all these vaccines are ways that we can prevent sexually transmitted infections. And then you have your barrier methods and then HIV specific methods. I'm going the wrong way. Okay, so 5 action steps to be sexually healthy. I think we left off the Y on that. And it's just value who you are and decide what's right for you, right? So earlier in the slide we said these are ways that you can decrease potential exposure to sexually transmitted infections. Ask yourself who you are, what's right for you in those different ways. Treat your partners well, and make sure your partners are treating you well too. Stay in a safe relationship, right? And make sure you get out when it's not safe. Build positive relationships. Get smart about your body and protect it. Know what your resources are, right? Or if you don't have them, try to get some or ask someone, hey, what are my resources? And make sexual health part of your routine health care. So when I go to my doctor, and first time I go to any new doctor, I don't tell them I'm a physician. I just go in there and I'm a patient. Take care of me. And no one asks me about my sexual health. They're like, you're married, aren't you? And I'm like, yeah, but you don't know about me. You didn't ask me. Like maybe we have an open marriage or, I don't know. Like ask me about my health. Give me my testing that I want. So pull the conversations and make it part of your routine health care. All right, so we've talked about the tools in the toolbox, and this is one example. Now, when people talk about condoms, they always visually, especially when we talk to med students and residents, and people always think of the male condom. So we're going to talk about the male condom. But remember, there's oral dams, there's vaginal condoms, so female condoms. So there are other forms of barrier method. And you can empower yourself with that because this is kind of dependent on the male partner. And females can also have some empowerment with some tools in the toolbox. So condoms, the male condom is a thin latex sheath that's placed over the penis. It prevents sperm from entering the vagina, but it also prevents fluid that may be infected with sexually transmitted infections, so it prevents pregnancy plus potential exposure to STIs. Their effectiveness varies. It's 86 to 97% effective using the condom in the right way, and sometimes, the lubricant, and if it breaks, and things like that. So the effectiveness varies depending on what you look at. But overall, it's a really good way of decreasing pregnancy potential and sexually transmitted infections. They're available over the counter, right? So that's great. It is, we talked about birth control. Condoms are an example of a barrier method. So what other tools do we have? So HIV specifically. So these methods do not protect against gonorrhea, chlamydia, syphilis, HPV, all of that. So this is HIV prevention tools specifically for HIV. And there's two concepts. Has anybody, so the virtual world, can raise their hands in the virtual world, and in person here, how many people have heard of PrEP? I'm not surprised because we're on TSU campus. We have TSU shape, good. How about PEP? Okay, great. Okay, so PrEP stands for pre-exposure prophylaxis, so that PR, right? Pre-exposure prophylaxis. Pre means before. So it's a method of prevention of acquiring HIV before you're exposed to it. And so PrEP, there's pills and injectables. We'll talk a little bit about what the options are. But you have to consistently use PrEP. Take it every day so you have this level of medication in your body. So if you were to be exposed to HIV, you could, the PrEP drugs are going to kick in to prevent acquisition of HIV. Now, all of the studies of PrEP's been around for now 2 decades. And all the studies, if you look at it, if someone takes PrEP every day, 99% of the time, it will prevent HIV acquisition. So it works well if you take it, right? So that's the key, like you have to take it every day. There's some other strategies with PrEP, but the most common is the everyday, once a day medication. We use PrEP, we'll get to that slide. So PEP, let's go to PEP, post-exposure prophylaxis. So that means using something after you've been exposed to decrease the risk of acquiring HIV. So post-exposure prophylaxis is PEP. So those examples could be, a sexual encounter with a partner that you didn't know status, or you found out status after the sexual encounter, and you want to reduce your risk for potential HIV, sexual assault, needle stick or injury, or sharing injection drug equipment. Those are other ways, because HIV is transmitted through sexually transmitted fluids and also blood. So injection drug use is part of that too. So PEP is given within 72 hours of the exposure. That is key because what we call non-human primate studies, every study that's looked at post-exposure prophylaxis at 72 hours is the cutoff. After 72 hours, if you don't get that medication in, the likelihood of you acquiring HIV goes dramatically up. So 72 hours is key. The sooner, the better. So if you're potentially exposed or you think you could be exposed, getting medication in within 24 hours is better than 72 hours, but definitely before 72 hours. Now, both of these medications use HIV medications, so medications we use for HIV to prevent HIV. Now, not the whole cocktail that we use, but parts of it. And those medications have been around even longer than they've been approved here for this indication. And so we know It's safe, it's effective, it works well, you're gonna do okay on it, okay? PrEP you take every day. Post-exposure prophylaxis, you take 28 days. 28 days after the exposure. But you start it before 72 hours. All right, so PrEP. So what are our PrEP options? So FDA has approved 2 different pill medications. One is called, those are the generic names, tenofovir, emtricitabine. And there's 2 formulations, and one is called Truvada, which is the brand name, and then the other is called Descovy. They pretty much function the same way. Little blue pill, you may see some commercials on phone, online, in your apps, but little blue pill once a day to prevent HIV. The other great exciting thing is we have a long-acting injectable medication. So instead of taking a pill every day, you can, there's an injection that is used every 2 months to help prevent HIV. Recently, in clinical trials that just came out this summer, there is an injectable medication that you can take potentially twice a year to prevent HIV. And those clinical trials were amazing results, so we'll see where that goes in the future. Okay, PEP, as I mentioned, 72 hours, the sooner the better, and you take it for 28 days. During that 28 days, you are monitored by a health professional. You'll get baseline testing and testing again at 28 days. So I'm sure there's more questions on PrEP and PEP, and we'll have a question session in a second. Okay, how many people have heard about DoxyPEP? Okay, so we talked about HIV prevention. So what's our tools for other STIs? So we know where there's vaccines, right? It's for HPV, for Mpox. For chlamydia and gonorrhea, chlamydia and syphilis, those rates are across the world, actually, the rates are like this. Okay, syphilis is just like this. Texas loves to be #1, so we are at the highest for syphilis, you know, and our congenital syphilis rates, which is very, very sad, is very high, which means babies are being born with syphilis. And it can be very dramatic for the baby to have syphilis with it. So we need to cut down the rates, right? So, but how do you protect yourself, right? And so DoxyPEP is something, it's used as a medication, it's inexpensive, it's well tolerated, it's safe. Has anybody ever been on doxycycline or minocycline for acne? Yes. Acne? It's the most common antibiotic used for acne. So it's been around forever. But what we know is for chlamydia, there is no resistance to the tetracycline family. And then, to syphilis. Now, gonorrhea, unfortunately, there's resistance, so it's not going to help against gonorrhea. But it's going to help reduce the risk of acquiring chlamydia or syphilis. And so a lot of the studies, it's ongoing studies, it's out there, it's approved for use. We're prescribing it to help reduce the risk. And so how do you take DoxyPEP? So it's an antibiotic. You take it twice a day, normally for acne and stuff. But for DoxyPEP, what happens is there's two different ways, just like HIV PrEP and PEP. So if you have an encounter, a sexual encounter, and you're concerned that you may have been exposed to chlamydia or syphilis or whatever, a condom broke, you can take 2 100-milligram pills of doxycycline right after that encounter within 72 hours to help reduce your risk of acquiring an STI. Then the other example, the second one, the example is, you know, it's a fun weekend, and I don't know, you know, we don't know what's going to happen in the weekend, and you just don't know, and you could take it daily during that period of time, 200 milligrams, 2 tablets daily during that period of time, if you don't know when the potential exposures are going to happen. and then you stop it after that. We don't keep people on doxycycline forever, but you can use it post-exposure or you can use it kind of pre-exposure. Does that make sense? The diagram really helps a little bit. Easy, cheap medicine. It is prescription, so you have to, that sexual health discussion has to go on with your provider. All right. So I think now we're at questions or moderation. Yes.
We have a couple of questions.
So I'm going to turn it over to our moderator.
Thank you so much, Dr. Patel. And at this time, we can have our speakers and panelists make their way to the front of the room so that we can have everyone see them from online. Thank you, Mr. Elkins. Okay, yes, we'll start with the online. So we have some, by the way, I'm sorry, my name is Nkechi Ogbo. I am the Health Equity and Community Engagement Pharmacist here at the College of Pharmacy at Texas Southern University. So it's my pleasure to moderate the event. Thank you, Dr. Wong. Thank you, Dr. Patel and Dr. Win for your time. I learned a lot too. So thank you for the information. Anyone on here who wants to start with the questions? If not, we've got some online that we can start with. Don't be shy. Don't worry, we'll not show your face. Or you can text it or put it online to the chat as well. Awesome. We have like 7 questions for you all. You ready? Thank you very much. Okay. So someone said that someone is asking, are the preventions and protection vaccines created for cures, or is it to slow down the problem of STIs? Oh, I'm sorry. Yes, you can. My apologies. Thank you, Dr. Patel.
All right, so I just want to make sure that I got the question correct. So the question is, are the vaccines for prevention or for slowing down the progression of STI?
Yes, ma'am.
Okay. So the vaccines that were mentioned, that's a very informed individual. So the vaccines that were mentioned on the slides are for they're preventative vaccines. So they're there to prevent. So hepatitis B vaccine, hepatitis A vaccine, hepatitis HPV vaccine are there to prevent. Now, an asterisk for HPV vaccine is when it first was approved, it was truly for prevention. Like all of the clinical trials were showed reduction in acquisition or getting HPV. And there are a lot of serotypes, so a lot of different types of HPV vaccine viruses. And so it was truly for prevention. But now, and so the age was 9 to 26 is what it's approved for. But the goal is to get people vaccinated earlier before you are exposed to HPV viruses. Now we give it regardless if you have a history of HPV, because there is some data that suggests that even though you may be exposed to one serotype, you may not have been exposed to the serotypes that cause cancer or cause cervical cancer in females and oral and rectal cancer in males. And so those serotypes are serotype 16 and serotype 18, which are in the vaccine. So the virus is in the vaccine, that protein is in the vaccine that help your body protect itself against it. And so it potentially can modulate the infection and prevent getting cervical cancer. So that one's the outlier. But hepatitis A, hepatitis B vaccine, they're there for prevention.
Thank you so much, because if I might add, and you forgive me, even being a practitioner, when my 14-year-old, when she was going for her visit and they were trying to tell me about the HPV, I'm like, well, she's not active, she better not be, and I would have said, oh, no, she's going to abstain till whatever, but I think that is important to know that apart from us thinking we know our kids, it's also a protective mechanism. So please remember that. Thank you so much, Dr. Pada, for bringing that up. I appreciate it. Now, a student is saying on a college, and I think this is for you, Dr. Gwen, if I'm not mistaken, on a college campus, where do I ask for help about my sexual health, especially if I am an out-of-state student?
Two places. And speaking at TSU or college campuses, your campus health center is the first place that you should start.
Okay.
At Texas Southern University, we kind of augment. In addition to the campus health center, you have the TSU SHAPE initiative, where we provide testing, treatment, education. Through a partnership with Dr. Patel at AETC, we even do provider educations that are open to our students as well. But I would say your first stop is your college health center.
Thank you so much for that. I appreciate that. And then if you don't mind me adding another question to that, for somebody who's not in TSU, but is listening online, or maybe know somebody who is like between the age of 18 and 26 and has no insurance, and they're asking you, where can I go to even just learn about sexual health? How can I get Doxy, PEP,
Okay.
knowing I'm about to have a fun weekend and I don't have insurance?
Few things. Away from TSU, any college has a campus health center, but also you tap into the resources in the community. We all have, here in Houston, we've got the City of Houston. We've got Harris County Public Health. We have Baylor Teen Clinic. Many places that provide services regardless of your ability to pay.
Okay. Did you hear that? Thank you very much. I appreciate that.
Can I add a comment
yes,
to
please.
that? So let's flip it to the other side. 18 to 26 is also the age where people can still be on their parents' insurance. And they raised the age to 26 a couple of years ago. And that's for some people, that's a challenge also, because if you go to a healthcare provider and you have to, you show your insurance, for those, if you're on your parents' insurance, sometimes you don't want that to show up on the bill, right? Because your parents are going to get that bill and they're going to say, oh, why did you go to this clinic? And one, it'd be great to have open conversations. I have a college kid, a teenager, and one to soon be teenager. I try to have them open up to me all the time, and they won't open up to me. But that being said, then using these other resources are important, right? Because you may not want to use your insurance. So the campus health center, the FQ8Cs, Avenue 360, Legacy, you're in college, you're not making income, so zero income, and you can get care.
Awesome. Thank you for that. I've got two other questions that just came up now. If we get an STI and get medicine, will we have it in our body still as far as bacteria but not harmful?
Sorry, I missed the question.
Yes. If we get an STI and get medicine, will we have it still in our body or as far as bacteria but not being harmful?
Okay. So if I'm thinking through all of the,
Okay.
So that's a big question because all the STIs don't function the same way. And so chlamydia, gonorrhea, and syphilis, if you get treated for those infections at the right stage, early on, or when you're tested positive for them, then they're treated. They're not there. They don't live latent, they don't live inside your body. HPV and herpes, those STIs, they can. So if you think about concepts of fever blisters, if you get fever sores, or when you're a kid, you get little warts on your fingers, those are HPV virus warts. So those are viruses that live with us. Herpes outbreaks can be treated, but it's called a latent virus. So and whenever you're under stress, there can have an outbreak. When you have a condition that compromises your immune system, there can be an outbreak. But there's a way to control those infections with treatment. And then HIV also integrates into our DNA. So there's no cure for HIV at this time, although there have been 7 people in the world that have been cured from HIV. But there's no routine cure yet. And I'll say yet because I think we will always surprise ourselves. And then what other STI did I forget? Syphilis. Okay, so syphilis. Syphilis is a little tricky. So depending on the stage that you're diagnosed with syphilis. So if you get diagnosed in early stage primary syphilis or even secondary syphilis, you get your shot of penicillin, you get your doxycycline for it, you're good to go. You're good. You have to take the medicine, make sure you take it all, but you're good to go. Tertiary syphilis is like a decade down the road that can happen, and that is damage that happens from long-term untreated syphilis. So that's why it's very important to get routine testing. Even if you don't have symptoms, routine testing is really important. 80% of people with gonorrhea and chlamydia don't know that they have gonorrhea and chlamydia because they don't have any symptoms.
Can I add to that?
Yeah.
And that question they ask if, after they're treated, if it stays. And as we said, syphilis is really tricky. And as in a former life before academia, I worked as a disease intervention specialist at the health department. And with syphilis, and you can explain titer a lot more than me, but oftentimes even after treatment, and syphilis is a bacterial infection which is treatable and curable, but sometimes you may have a blood test and it, you may still have a titer. And over time, it goes, but
titer doesn't mean active infection.
Right.
You have to continue monitoring it.
Okay, good to know. Thank you. We have somebody who has a question. If you don't mind, let me give them the mic so they can. Go ahead.
Hi. We had like a shared question. I noticed you mentioned that, I think you said, was it? Oh, the breast milk. How does diseases and STIs get into the breast milk?
So I think maybe breastfeeding breast milk is very tricky. But maybe you're referring to when I said congenital syphilis, babies being born. So that actually is that the mom or the pregnant person acquires syphilis during pregnancy. Typically, what we're seeing is many people are acquiring syphilis during their third trimester, and then during that phase, you get the spirochete or the bacteria circulating in the blood, and it goes through the placenta to the baby, and the babies are born with syphilis. So for the breast milk question, gonorrhea and chlamydia are not transmitted through breast milk. I guess you can argue potentially for secondary syphilis, if a pregnant person has breast mastitis, like bleeding and stuff, or a lesion like around the breast, that you could potentially pass syphilis on to the baby that way. HIV is a virus that can be transmitted through breast milk, and in the United States for a long time we said if someone had HIV, you could not breastfeed. It's recommended not to breastfeed in the United States, but in the low-income countries, the recommendation was not there because more babies died from diarrheal dehydration than from HIV, so people were breastfeeding in Africa. In the US, the guidelines have changed because we have great medicines for HIV now, and you can get that non-detectable viral load that we talked about. And so as long as the pregnant, the lactating person has a non-detectable viral load, it's okay to breastfeed.
I also want to share something about breastfeeding, but more about stigma as well. So Dr. Patel talked about HIV and breastfeeding. Many years ago, as a DIist, when a woman living with HIV was pregnant, had a baby, of course, the baby has a mother's immune system, and it will test positive initially. Well, we would follow that mother and baby and test you at 3 months, 6 months, 9, and 12. Well, there was one mother, and she, of course, was HIV positive, knew that, and at that time, this was 25 years ago, knew that the recommendation was not to breastfeed. She said that there was a lot of stigma in her community, and there was stigma in her community, and there was rumors that she was HIV positive. She said that she was with other women that were breastfeeding, and she felt like everyone was looking to see if she was going to or not. She did. And after a negative test, because 3, 6, 9, and I don't remember, maybe one of those tests was positive, and we were baffled. And then tested again, and it was. And then she shared that because of the pressures that she faced and the stigma that she did. Now, I don't know if it was one time or what, but that's something that I actually saw in my career, where a child, got HIV from his mom breastfeeding.
And it can happen. We see it in the African community that had immigrated to Houston, because it's very much in Africa. If you aren't breastfeeding your baby, that means that you most likely have been diagnosed with HIV. And stigma is a big deal in trying to help care for the mom and care for the baby. Like, how can we reduce that and have those open conversations about it?
That is very, very, I'm saying I'm learning. Thank you so much. I had a question. Dr. Gwen, you mentioned the first time I've heard this word before, sex positivity. Now, for a college student, how can they break through like barriers and social stigmas and even barriers to speak with their partner about maybe themselves or their sexual health?
That's what we're trying to do here, and that's sex positivity, normalizing the conversations. Normalizing conversations about sex, normalizing conversations about PrEP. We should be talking about PrEP like we talk about birth control, because PrEP is essentially birth control for HIV, preventive methods. So why should that conversation not be as common as the conversation about birth control? So that's what we're trying to do here, normalize conversations. We have things called spark groups where, we just get students to talking. Again, wanting you to be comfortable. We sex positivity, body positivity, just being okay with those conversations. And we say all the time, I don't yuck anybody's yum. In other words, I don't judge you for what you like, but I'm going to teach you how to be sexually healthy.
Thank you. Since you mentioned PrEP, I have 2 questions that came, and it can be for you, Dr. Wang or Dr. Patel. Question: you mentioned the explanation of the doxy. Sorry, of PrEP. Let me start with PrEP first. Let's say somebody is taking PrEP, which is a pre-exposure. You have been taking it diligently. I know you mentioned that usually if the person gets an exposure, nothing usually happens. If they were 99%, being accurate. The question is, let's say somebody maybe gets, God forbid, raped while they were taking it. Is there still, what happens in them? Asking for the person who probably has the question. Do they switch to PEP? To post, yes, post, or they just continue with what they were doing?
Yeah, that's a great question. I think in sexual assault situations, I think it's a case-by-case basis. Okay. So PrEP works very well if you're able to take it every day. And in the conversation with the person who experienced a sexual assault, you have to be very convinced that there was no challenges in taking that medication every day. Because there could have been, I couldn't get my refill for a week, or I left my bottle somewhere and I was somewhere else, or anything. So if there's any doubt, we would put that person on post-exposure prophylaxis for 28 days, and then put them back on PrEP if they want to go back on PrEP.
Good to know.
Yeah.
Okay. Then I also wanted clarification on doxy-PEP. I saw that for the person who is certain of what is going to happen, you only take 2 of the 100 milligram doxycycline. Is that correct? Just a one-time dose?
One-time dose,
okay.
2 tablets, because they come in 100 milligrams, and you take it every day during that period of potential exposure.
But the one that was on top that had the one time?
Okay, so if let's say you had a sexual encounter and you didn't know the status of your partner, and you forgot to use barrier protection, you take it
just one time?
One time, 2 tablets, okay, within 72 hours, ideally the next day, or within the 24 hours.
Okay, then on, I'm asking questions.
I know.
Hopefully somebody's getting something. The question I had was, I think it's Dr. I don't remember which one, but you mentioned that when one has the STIs increases the risk of someone getting HIV, and somebody will say, if why? Because I understand the reason why HIV will cause your immune system to be low and stuff, but for somebody who is not clear about that, how can we explain that further as to why that would happen? If the more you get STIs, the more at risk you have for HIV.
Yeah. Do you want to give me an answer?
I'm gonna give you a street analogy.
Okay, you give me a street analogy.
All right.
Do you want me to give you mine
Yes.
first and then the street
All right.
analogy?
Yes.
Okay, I'll give you mine. If you just think of like pathology, STIs cause irritation, inflammation to different tissue parts, right? And so when you have irritation and inflammation, then you have a higher risk of other viruses getting into that space because you have a break in the barrier. What's your barrier? Your barrier is your skin, your upper layer of all mucosa, and you have a break in that barrier, and so that increases the risk of another virus coming in and taking up shop. And so that's why it increases your risk. And you have more sores and things like that. Now, give your street.
Well, let's just say you came down, all right? And we have a fight. I might be able to handle you one-on-one. However, if the two of you and the three of them back there all jumped on me, I can only fight one thing at one time.
There you go.
Thank you. Actually, those inflammation, some of the biologists make them feel like the cells, actually those gap between the cells not tight anymore. So that allowed the more virus, bacterial to get into and get infected.
Thank you for that analogy. That actually stuck, so thank you for that. Somebody had written in the chat and asked the question, asking that, what are some bumps that they will see and they're thinking it's an STI, but probably it's something else?
You know, it's so hard.
Yeah.
You know, every time you do every time I used to do an STI presentation, when you talk about signs or symptoms, you almost scare people because those signs and symptoms could be so many other things.
Yes.
So it's hard to say what this bump is. You have to know the context around that, I feel.
Yeah. And I just, you know your body, right? And if something is different in your body, get it checked out. It may be nothing, but just get it checked out and then have that conversation with that provider. Let them know so they don't kind of like dismiss. So in healthcare, we say, okay, here's our differential diagnosis. Like, here are all the possibilities. You come in with a cough and cold. What are the list of things that it could be? And it could be tons of them. And some of them we're like, no, you're not going to have bird flu because we don't have bird flu in the community right now, right? So that's going to go to the side. So if they don't know the context, then they may dismiss things that may be going on with you because they don't have all the history.
Yeah, we talk about the regular testing. If anything suspicious, you think you should always open communication with the providers and get tested. Yeah.
And then, as Dr. Patel said, ladies, know your body. Know what your normal discharge is. Know your body. When you know your body, you'll I guess, quickly see changes. And then when you do follow up, oftentimes fear prohibits us from moving on things. Don't let it.
And sometimes things that you think are abnormal may be normal.
True, thank you. A question, what are some common misconceptions about STI transmission among young adults, and how do these impact the student's health?
Oh, it won't happen to me. I'm not doing what they're doing. I'm not promiscuous. I'm not this, I'm not that. I can tell you that most people I shared an HIV diagnosis with weren't. It may have been one or two partners. It's not, and oftentimes people think that it is that gay disease or this or that. I'm not doing what they're doing.
Mm-hmm. If you're having sex and you and your partner are not equally getting tested all the time, you're at risk.
Thank you.
So when they
Drop
talk
mic.
about who should be on PrEP or offered PrEP, everybody that's sexually active should be offered preventative tools. And then they can decide if it's right for them.
Awesome.
We often actually see in clinical, and the people think they only have one partner, but they got the STI. It's because cannot guarantee the partner has multiple partner. Yeah. Also, one time I heard about like HIV is curable, so it's okay. So that's the big misconception. HIV is not curable. It's treatable. It's not curable.
If I might ask this question, and we're not trying to get into like real like data or hard facts, what's the stats saying? Somebody had asked there regarding like STI transmission or infection in the different ethnic minority groups.
I mean, definitely there, just like any other kind of conditions, there is a disparity. There's definitely disproportionate number of STI infections in individuals who can't access health care in African American Black communities because of the social determinants of health and access. And so the rates are going up across the board, but definitely there's a disparity and a disproportionate impact in different populations.
And especially, well, of course, HIV in Black women, MSM. Now, and Dr., y'all be able to get me. I remember that a couple of years ago in Texas, or was it Houston, that our rate was higher than it was in Texas and in the nation in terms.
Harris County.
Yes, yes.
There was something I was going to say, but I forgot. So it'll come back to me.
No problem. Thank you. Does anyone else have any final questions before we round this up? Thank you so much. Yes, one. Please go ahead. Let me have it. Do you want to read it or should I read it? Okay. The question is, how about for students who attain that STDs? Let's see. How can they live with them and strategies to help them from accidentally giving to others? So for somebody who has STDs, how can they go about life living with it, and then how can they prevent transmitting to others?
Well, for those that are treatable, you get treatment, right? And then for HIV, you get on treatment, and we know U equals U. Undetectable means untransmittable, right? So get access to treatment, and if you don't know how to get access to treatment, go to your health center and talk to them, or go to Tissue Shape, and they will get you connected. And then for the viruses that I talked about, like herpes and HPV, they lie latent, but they reactivate and lie latent. And so when they're latent, you're not likely to transmit. So if you don't have open sores, you're not going to transmit. So being conscious of your body, and like if you have open sores, probably that's not the time to be involved in a sexual relationship at that point, and get things treated and get on treatment, and then make sure the sores go away. Because those viruses lay latent with us and activate when we're stressed. Mm-hmm. But keep in mind also, it's important for you yourself to get treated, because you had a slide on it, you talked about it, but each one of these STIs has complications to it. So yes, they're treatable. Gonorrhea is treatable. Chlamydia is treatable. Syphilis is treatable. But we see complications from gonorrhea where people get arthritis and have to end up in the hospital. And chlamydia can cause pelvic inflammatory disease and cause infertility. So getting tested regularly, getting on treatment as soon as possible, and just using the prevention tools. Yeah.
Thank you so much. We appreciate you all. Any last words before I give this back to Mr. Kings? I thank you for your time. Thank you for teaching me also. Appreciate it. Thank you.
Something that we don't talk about. Thank you just for talk. It's something that we don't talk about enough. So thank you all.
Thank you. Thank you. Anyone has any questions? You guys good? Thank you.
I just want to thank the virtual audience and the audience that's here. Yes. Because knowledge is power, I think. I for sure think knowledge is power.
Exactly. And don't be afraid to share the information. Nothing that we said may affect you, but share that information with someone.
Yeah, bring it to the community.
Yes.
All right, everyone. Let's give them a round of applause for a wonderful presentation. Thank you so much for that valuable information. We truly appreciate it, and it's definitely necessary and needed on the TSU campus. So in moving on, we are at the conclusion of the program. So again, I want to say thank you all for joining us. If you haven't signed in online, please click on the link to sign in online. Also, for those of you that are here, make sure you scan the QR code to sign in online, as well as look at our upcoming events and activities that we do have coming up in the next month or two. Next, I want to talk to you guys briefly about a program that is open to freshmen and current TSU students here at the Texas Southern University. So the P20 Cure Summer Research Program is a collaboration between TSU and Baylor College of Medicine, and it provides a unique opportunity for students interested in cancer-related fields. It's funded by a $2.4 million NIH NCI grant, and the program aims to address cancer health disparities in African American communities, foster diversity in cancer research, and strengthen TSU's research capabilities. Through this initiative, students gain hand-on experience in cancer research, build professional skills, and work directly with mentors on impactful projects in lab, clinical, or epidemiology research settings. Participants also engage in community outreach and present their findings, creating a well-rounded experience that promotes both research and service. Eligible students include TSU undergraduates, graduate students, and incoming freshmen with a GPA of a 3.0 or higher. The program, which runs full-time from June 9th to August 4th, 2025, offers a competitive stipend of $4,000 to $5,000 and provides pathways to graduate studies or careers in cancer research. Also, interested students can apply online by January 31st, 2025 with a cover letter or curriculum vitae, and a letter of intent, and notifications of acceptance will be sent by the end of March. This program offers a transformative research experience for students to grow professionally, contribute to cancer health equity, and be a part of a diverse biomedical research community. So that is the TSU and Baylor College of Medicine P20 Cure Summer Research Program. So if you would, scan the QR code, or also if you have any questions about that, we'll definitely answer them out there at the table, or our QR code that you saw earlier will have our contact information on there as well. A couple of events that we have coming up, a very, very important event, the Maternal and Child Health Education and Outreach event, which will take place on Friday, January 24th, here on the TSU's campus in the Public Affairs Building. There will be lunch. Lunch will be provided. It's a free event and open to the public. There will be mobile units available that will do free biometric screenings, as well as a sign-up sheet. Well, we'll have a sign-up sheet for mammogram testing, free mammogram testing, and other testing as well. And then also we'll have our Clinical Research and Engagement Conference on Saturday, April 12th from 9 a.m. to 3 p.m. They'll serve light breakfast, as well as lunch will be provided for that event, and it is open to the public. So we hope to see you all there. Again, on our QR code, you will see that these are more upcoming, or these are the events that are upcoming, and you'll be able to register for those events there. So the Community Engagement Corps, we host health education seminars every month, and this is a list of our events and activities. As stated before, this QR code will lead you to our upcoming events. Our next event will be December 3rd at the Brenda and John Duncan YMCA out in West Houston. More information is on our website. We want to thank you again for participating and joining us, our online visitors, as well as our visitors in person, for joining us for this wonderful and impactful, informative presentation today. Thank you to our guest speakers and panelists. We really appreciate it and really enjoyed the message that you brought today. Follow us on our social media platforms, on our Facebook, Instagram, Twitter, YouTube, as well as LinkedIn. And if you have any questions, if you can reach us by phone, 713-313-1233, or via email, cbmhrcommunity@tsu.edu. Thanks again and have a wonderful evening.
Hello again. My name is Veronica Ajewale. I want to say a big thank you to each and every one of you for joining us for today's program. I am very certain that you have received a lot of great information that you will put to practice as we all grow together to become a healthier community. Thank you to our speaker and our panelists. Thank you for sharing today's content with us. Thank you to our locations. Thank you to our interns, our volunteers, to our sponsors and our funders. Thank you also to the staff of our program, the faculty, and the leadership of Texas Southern University for supporting us in making today's program a success. Most importantly, I want to say thank you to each and every of you, the community members. We appreciate your support. We do not want today's program to end just with today's event. We want you to continue to collaborate with us and engage with us. Our social media platforms are located at CECTX Southern U. On those platforms, you will find engaging information from today's program and all the other programs that we have going on in the Community Engagement Corps. So we implore you to continue to stay connected with us, engage with us as we move forward together in building a healthy and a wealthy community. Thank you for joining us, and we look forward to connecting soon. Bye.